Welcome to Biomesight's Ask Me Anything episodes, hosted by Dr. Carly Polland, clinical lead at Biomesight. Biomesight is an AI-driven wellness analytics platform with a primary focus on the gut microbiome as a leading indicator of wellness. In these episodes, Dr. Carly will be answering your microbiome questions. Dr. Carly Polland specializes in the intersection of hormones, the microbiome, and the immune system in health and disease. She works primarily with individuals with autoimmune diseases and chronic digestive issues. While Dr. Carly is a doctor, she is not your doctor. These episodes are not intended to diagnose or treat medical conditions. Ask your doctor before making any changes to your health regimen. So the next question is, how does choline supplementation affect the microbiome? So from my understanding from the research, we do need more research in humans to fully answer this question. There is some research in cows that found that choline supplementation increased the abundance of Firmicutes, Proteobacteria, and Actinobacteria, and decreased the abundance of Bacteroidetes. But that study did not look too closely at the genus or species level. So the biggest concern with choline supplementation in the microbiome is if you already have a high amount of TMA producing bacteria. So those bacteria, they're going to take choline and they're going to convert it into TMA. That's going to be absorbed into your bloodstream and it's going to go directly to your liver, where your liver will then convert it into TMAO, which then is associated with plaques in your arteries and cardiovascular disease. So where we're at with the research is the choline supplementation is only going to be problematic if you already have higher amounts of those bacteria. So I believe we need more research to fully pinpoint the mechanisms of TMA production and who can do that. But so far, we're seeing some Anaerococcus species, a couple of different Clostridium species, and some Escherichia and Proteus species being primary TMA producers. So choline supplementation may be safest in people who have low amounts, and then we still need more information about how then that supplementation would fully impact the microbiome in a human. Next question is about fat consumption from oils such as olive oil and flaxseed, and essentially how much to have a positive impact on the microbiome. Essentially, I do not have the answer to that question. And I think that it's really going to be individual dependent. So some factors here are going to be about your bile production and the makeup of your bile acids and how much you are actually emulsifying and absorbing these oils. So then how much is actually reaching your large intestine. So there's a lot of individualized factors there. And also different microbiomes are going to respond differently to the same things. So that is the other individualized piece here. But definitely in terms of this question, as far as the research shows, the plant-based oils are going to have a more beneficial impact on the microbiome. Definitely a lot of evidence showing that saturated fat intake has a negative impact on the microbiome, possibly through how it is influencing the type of bile acids. But typically we see an increased amount of hydrogen sulfide producers, which is going to be inflammatory. So I'm not able to fully answer this question, and my recommendation would be to do some experimentation on yourself. So try different amounts of these oils and test your microbiome and see what it says. And then change the amount of oil and retest and kind of see where you're at. But oil consumption here, fat consumption, is not going to be the only factor influencing your microbiome and keeping it healthy. I would say that focusing in on fiber content and prebiotic content is going to be way more important to maintaining a healthy microbiome than your fat consumption. So the next question is about the Firmicutes-Bacteroidetes ratio. So this is a rather controversial topic, and this is a great question because yes, there is a lot of conflicting information out there. So here is what happened. So back in 2006, there was a study that suggested that if you had higher amounts of Firmicutes, that you were more at risk of obesity. That was in an animal study. That was not even in humans. After that, there were some additional animal studies and a couple of human studies that supported that result. And so at that point in time, they were thinking that maybe Firmicutes bacteria extracted more energy from food. But the majority of the research since then did not support those results at all. So newer studies confirm that the Firmicutes-Bacteroidetes ratio not relevant to obesity. However, there are still a lot of stool testing companies that will report on this and talk about it in the context of obesity. So in my clinical experience, I do see people having better gut health and overall health when they do have more balanced Firmicutes or Bacteroidetes or more Firmicutes. If Bacteroidetes is dominant, then usually their butyrate production is on the lower side. So I like to support the Firmicutes because that is our primary butyrate producers, as well as other beneficial bacteria like lactobacillus. So that is based on my clinical experience. The research does not have a definitive, this is the best ratio. But essentially, I would not worry too much about that ratio and what it means for your health. The next question is about the use of the probiotic L-reuteri 17938 and how it is impacting the microbiome, particularly the level of Firmicutes. So I cannot speak to this probiotic in particular. I have not used it in isolation in clinical practice. Based on my experience, I do not find in clinical practice what the research says is happening with probiotics. And as I said before, I do not find probiotics to be a very helpful tool to modulate the resident microbiome. Herbs, prebiotics, and nutrition are way more impactful on changing the resident microbiome. Now, probiotics, there's a couple of things here. So most of the research supports that probiotics do not colonize your gut. They might hang out for 2 weeks. They might do a little interaction with your resident microbiome. If they're still alive by the time they get to the large intestine, and they also might interact with your immune system, with your cells lining your gut. So they can do some good work while they're there, but I do not see them having any significant or long-lasting impact on the resident microbiome. And sometimes when we retest taking these probiotics, we are not seeing any increase in the relative abundance of the species that says they are. So that also raises the question about the quality control of the probiotics. So does that probiotic actually contain what it says it contains? Is the probiotic viable? Is it alive in the bottle before you take it? Can it make it through your digestive tract all the way to the large intestine? A lot of factors to consider there. And the other thing is going to be the dose and whether or not that is actually going to have any impact on your resident microbiome. The last thing to think about here is most probiotics are going to be some sort of lactobacillus species or bifidobacterium species. So your resident population of lactobacillus is typically, most commonly, is about 0.1%, maybe up to 1%. Very small amount of your resident microbiome. Bifidobacterium, a lot of people are coming back very low on it. We would like to see that kind of 2 to 5%, but still a relatively small amount of your microbiome. So if these species are not making up very much of your microbiome, why would you expect a probiotic of those species to have some massive impact on your microbiome? So I think there's a lot of limitations to probiotics, in particular when it comes to modulating the resident microbiome. In my clinical experience, I've seen very minimal effects. And again, prebiotics, that gets me the results I want to see. That gets me significant changes in relative abundance. Herbs can as well. And then nutrition, looking at fiber and prebiotic content, polyphenols in your food, making sure that you are balancing your protein and fat intake for your microbiome, all of that. So the next question is about oxalate degrading bacteria in the microbiome and how to boost those species. In your Biomesight results in the menu, if you click on intolerances, you can get a breakdown of your oxalate degrading bacteria. And so as you can see, the primary bacteria involved in this are going to be Bifidobacterium, Lactobacillus, and Oxalobacter. So Lactobacillus, you can support primarily, I would think about prebiotics. So we're going to think about lactulose can be really effective. Lactulose is a prescription prebiotic in the US, unfortunately. Galacto-oligosaccharides, fructo-oligosaccharides, and very long chain inulin. For bifidobacteria, we are also going to think about prebiotics as our first line treatment here. So galacto-oligosaccharides, fructo-oligosaccharides, xylo-oligosaccharides, lactulose as well, and human milk oligosaccharides. I've seen some good things there. Partially hydrolyzed guar gum, and then just generally increasing your fiber intake in your diet. In terms of Oxalobacter, I have not in clinical practice tried to target that one, so I can't speak to what is most helpful there. And I wasn't able to find too much research supporting what prebiotics or what herbs would be the most helpful to boost that bacteria. So the next question is, could high oxalates in your bloodstream essentially contribute to migraine? Yes, potentially. In my clinical experience, migraines are multifactorial. So oxalates may not necessarily be the be-all, end-all to migraines. The next question is about die-off symptoms. Okay, so die-off symptoms. So basically what's going on here is when we kill certain bacteria, they are going to split open and they're going to spill their contents. The most relevant content here for die-off symptoms is going to be LPS. So LPS is going to be coming from primarily Proteobacteria. Bacteroidetes also contain LPS, but it is much less inflammatory and not, in my opinion, that clinically significant. But when we're killing Proteobacteria, you can expect to experience an increase in LPS absorption into your bloodstream. And so that is going to cause a lot of different potential symptoms for you. So basically, any existing symptom you have now may get worse. We can also see a lot of digestive symptoms. So sometimes people start experiencing abdominal pain. We can see changes to the stool frequency, consistency, all that's typically trending more on the side of diarrhea. We can see more gas and bloating. And systemically, typically what I see is increased fatigue, increased brain fog, generally feeling like you are almost coming down with the flu. So we might have some aches and pains as well. Typically, my patients, when they're experiencing extreme die-off, describe it as they just don't feel like getting out of bed in the morning. In my clinical experience, die-off is going to be the most problematic when you are treating small intestine bacterial overgrowth. And it is also, die-off is going to depend on the patients. So I have some patients, whether we're killing Proteobacteria in the small intestine or the large intestine, they are absolutely fine, no issues. Other patients, they tell me that they felt like they were dying. And typically, the more sensitive patients I have found are the ones who already have a lot of inflammation or maybe have already been diagnosed with an autoimmune disease. So on the one hand, die-off symptoms may indicate that the protocol is working and you are killing the bacteria. However, it can be a very unpleasant experience. And like I said, it's going to differ depending on the person. So it can be quite severe. It can be very mild. It can last for a day or two. It can last the entire time that you're on the treatment. Really depends on the person. But the other consideration for some of these protocols, depending on what you're using, especially if you're using herb, these symptoms may not actually be from the release of LPS from the bacteria and may actually be a direct side effect from the herbs and possibly by how the herb is impacting your liver function. So sometimes it is hard to tell, is this a direct side effect from what you are using, or is it actually die-off symptoms? If you are having die-off symptoms, there are a lot of different things you can do to treat the specific symptoms, but typically trying to manage the LPS is a really good way to go. So you might think about using a binder an hour after you take whatever you're using in your protocol. So the idea there is that, you take your protocol and it goes in, kills the bacteria split open, they're dumping the LPS, and then here comes your binder, such as activated charcoal. It binds up that LPS before it gets absorbed into your bloodstream. And so then you poop it out and you don't experience the symptoms associated with the increased LPS. So that can be a very good strategy. There are various types of binders. Activated charcoal is the easiest and cheapest to find. There's lots of other clays and fibers that can act as binders. There's also serum bovine immunoglobulins. I have not found the serum bovine immunoglobulins to live up to the hype. Usually good old activated charcoal is good enough. The next question is about the effects a cholecystectomy, so removal of the gallbladder, would have on the microbiome. So yes, this is going to impact the microbiome. We need a lot more research to fully explore this area. But one thing that I have seen in clinical practice that I have seen backed up in the research is an increase in Bacteroidetes. So what's going on when you have your gallbladder removed? So your liver makes your bile, and then it is going to store it in your gallbladder if you have it, so that bile is only released with a meal. When you don't have your gallbladder, your liver's still making bile, but it has nowhere to store it. So you are kind of getting a somewhat constant, slow drip of bile into your intestines. So the interaction between bile acids and your microbiome is going to be different when there is no food involved. So most of the studies have looked at the large intestine microbiome, but I think it'd be really interesting to see how it is also affecting the small intestine microbiome, as that is going to be the first microbiome that will be impacted by this. But in the large intestine microbiome, I have seen higher amounts of Bacteroidetes, and I have also sometimes, not always, seen higher amounts of hydrogen sulfide producing bacteria. Both of those classes of bacteria are capable of metabolizing bile. So that is most likely why we're seeing higher levels of those guys in these cases. So I would say that managing these changes in the microbiome can be challenging. So I have seen a higher fiber diet can be helpful. So decreasing the amount of animal fat and animal protein that you're consuming, which is going to change your bile acid profile, that can be helpful. And just getting more fiber in your diet to bind up these bile acids. Supplementing with specific beta glucans can sometimes help decrease Bacteroidetes. However, that is not a great long-term strategy because the most effective beta glucan supplement is quite expensive, and you would only see these results while you are on the supplement, so you'd have to continue it indefinitely. So the next question is about how menopause might affect the microbiome. So definitely sex hormones have an impact on the microbiome. The research is in its infancy in this particular area, so we need a lot more research to really fully investigate this. I would say that I have not seen any striking definitive differences in my premenopausal and postmenopausal patients in terms of their microbiomes. I'm seeing the same sorts of patterns, the same sorts of issues, and those patterns and issues are going to be more strongly explained by their medication use and their diet versus where their sex hormones are at. And I've definitely initiated a lot of patients on hormone therapy, and I have not seen that make any super significant impact in the microbiome. Now, the other piece to this question is about sex hormones and how they impact the gut itself, not necessarily the microbiome. So sex hormones have multiple mechanisms in which to impact the gut. They can directly impact the gut. They may impact the brain-gut axis, so kind of through the nervous system have an impact on the gut. And they can also impact other hormones, but that then have an impact on the gut. So sex hormones may play a role in your visceral sensitivity, motility, your gut barrier function, and also the general immune function in the intestinal lining. So as most women have experienced throughout their menstrual cycle, they may have different digestive symptoms that come up. So sometimes we see some bloating around certain times of our cycle. Sometimes we can see constipation or diarrhea at different times in our menstrual cycle. And so that can be attributed to the influence of sex hormones. So once your estrogen and your progesterone have dropped through menopause, yes, your gut may function differently. So sometimes we do see newer digestive issues, and sometimes I see a lot more heartburn after menopause. I see changes in bowel movement sometimes after menopause, and using hormone replacement therapy may have impacts on your digestive function as well. I've definitely seen this be very individual, the response. So for some people, using estrogen post-menopause actually causes some digestive symptoms for them, whereas progesterone sometimes can worsen heartburn or trigger some heartburn for patients. So there is a very complex interaction here. And yes, we need to be thinking about how our sex hormones are impacting our gut in general, as well as the microbiome, and how that may all then translate to digestive symptoms. The next question is about why someone may have high Akkermansia. So Akkermansia is primarily a mucosal associated microbe. So there are two distinct parts of our microbiome. So the one is essentially in the lining of our gut, which has a nice mucus layer. And then there is what we call the luminal microbiome. And so that is what is going to be coming out in our stool. So Akkermansia's primary location, primary function is going to be in that mucus layer. So if you have higher amounts of Akkermansia in your stool, there are a couple things to consider. That may indicate that you have more mucus in your stool. You may shed more of your mucus when you're constipated, and also when there is inflammation. Now, the other thing to consider here is Akkermansia is going to be associated with the mucus, and so it's not going to be evenly distributed throughout your stool. So for some patients, when they're testing high on Akkermansia, what actually happened is they hit an Akkermansia cluster in their stool when they sampled. So I like to instruct my patients to catch their entire stool sample and then insert the swab at 10 to 15 different locations to try and overcome the fact that bacteria are not going to be evenly distributed throughout your entire stool. So the last question is about pelvic floor dysfunction and outlet dysfunction. This is not necessarily connected to the microbiome. And when it comes to pelvic floor dysfunction, I am not an expert. That is not my area. I definitely would refer to a pelvic floor physical therapist to fully explore that. So in terms of outlet dysfunction, I assume we're talking about outlet dysfunction, constipation. So with this, there are a lot of different things to consider. So this can be somewhat essentially learned behavior. So if you have chronically ignored the urge to defecate, that can essentially result in this miscommunication between your brain and your muscles to actually coordinate those bowel movements. Another common scenario here is when someone has overused stimulant laxatives, whether that is an over-the-counter stimulant laxative, like a common one being senna, which is in many herbal products for constipation. That can result in outlet dysfunction, constipation. And then another common scenario is after childbirth and how that impacts the pelvic floor and all of those muscles. That can lead to outlet dysfunction, constipation as well. In terms of getting this properly diagnosed, I would say that's more difficult. We do need some studies to support this diagnosis. And what I have found most common in conventional medicine is that doctors do not want to work up constipation. They do not want to do any testing, any investigation for constipation, and that is because of standards of care. So typically, they start by recommending a laxative, and they go from there. So it can be really difficult to get the proper testing, to get the proper diagnosis. So working with a good pelvic floor physical therapist can be very helpful here. And also, this may be done with the pelvic floor physical therapist. Using biofeedback can also be quite helpful here. Head on over to biomesight.com to purchase your stool test kit to discover your microbiome. Practitioners can register for a free account to get access to our gut microbiome analysis platform that supports FASTQ uploads from multiple labs.